Okay. A very good evening to one and all present here, and a very heartfelt gratitude to everyone for joining the webinar today and taking time out on your Sunday. My name is Dr. Ammarah Ravi. I have completed my bachelor's in physiotherapy from M.A. Rangoonwala College of Physiotherapy and Research in Pune. And I have been a student of Rangoonwala Foundation India Trust. Rangoonwala Foundation India Trust is a well-known trust in Mumbai, and it conducts a lot of social work activities for students. Like they have scholarship programs for students in various faculties like hotel management, engineering, physiotherapy, and others. And as part of their scholarship program, there are certain volunteering activities that we as students have to do. And this is just one of those volunteering activities, which is to conduct a webinar and to spread awareness and reach out to people and give back to society in whatever form that we can. So the topic for today is awareness on TB and the impact of COVID-19. So whatever questions that you all have, you all can place it in the chat box, which will be answered at the end of the session. And also, we have feedback forms. So I request you all to wait till the end of the session and fill the feedback forms before leaving. Uh, After the feedback forms are filled, we will be giving you all a certificate. So please make sure that you all enter the correct email ID in the feedback form. Um, Yeah. Also, this session has been is being broadcasted live on YouTube. So that has been in association with Pharma Knowledge. By the channel is owned by Mr. Chinmay Kulkarni. Okay. So we'll begin today's program. The top, as you all know, this is about tuberculosis. So this initiative is taken by the government of India, and it aims to make India TB free by 2025. So, Rangoonwala Foundation India Trust, by this small effort of spreading awareness about TB, is just trying to help the government of India in making India TB free. So, what is TB? Tuberculosis or TB, as it is commonly known, is an infection that usually affects the lungs. So, tuberculosis is basically a bacterial infection, like any other bacterial infection that we come across. Okay, so the bacteria which causes TB is called Mycobacterium tuberculosis. Now, mostly there is a misnomer among people that tuberculosis affects only the lungs. अगर खांसी हुई है तो टीबी हुआ है, but that is not the case. TB can also spread to other parts of the body. Like अगर वो बैक्टीरिया आपके lymph node, abdomen, bone, joints, spine या brain में जाता है, तो वो पार्ट्स को भी वो बैक्टीरिया अफेक्ट कर सकता है. लेकिन कॉमनली जो टीबी दिखकर आता है वो लंग्स का होता है, एंड दैट्स व्हाई इट इज मतलब पीपल यूजुअली एसोसिएट टीबी टू लंग्स. ओके. So it is the most important part about TB is that it is curable and preventable. Uh, how is it preventable? Firstly, if you keep your immunity good and if you maintain your hygiene and health, it is preventable. And even if a person gets affected with TB is 100% curable, 100%. There are just certain principles that you need to follow while you are affected with TB, which will help you eliminate TB completely from a person's body. Okay, the most common medium through which TB spreads is through air. TB mostly हवा के through फैलता है. So when people with lung TB cough, sneeze, or spit, they propel the TB germs into the air. ओके तो कोई भी टीबी का पेशेंट अगर खांसता है, छींकता है पब्लिक प्लेस में, स्पिट करता है, तो वो जर्म्स जो है वो हवा में आते हैं, और जब वो हवा से दूसरा इंसान इनहेल करता है तब दूसरे इंसान को टीबी फैलता है, इन्फेक्ट होता है. सो दिस इज हाउ टीबी स्प्रेड्स. ओके, but like I said, other than lung TB, there are also other types of TB, and not all types of TB are infectious. क्योंकि हर टीबी में खांसी नहीं होती है, so that's why germs are not propelled into the air, and that's why it is not infectious. So how does TB spread? Okay, so in this diagram, as you can see, the droplets from the cough or sneeze contain germs, and these droplets, when they are in the air, and if the person is inhaling the same air, matlab is in close proximity with a person who has TB. Jaise if there is a person who is in room A and he has TB and he has coughed, okay, and there is a person in that same room A, only then through that same air will TB spread. लेकिन अगर कोई पर्सन ए है, सॉरी, कोई पर्सन है जो रूम ए में है, वो खांसा, और रूम सी का पर्सन है, उसको वाया रूम्स इट वोंट स्प्रेड. ओके, बेसिकली आई एम ट्राइंग टू से कि अगर डिस्टेंस ज्यादा है, तो इफ यू आर नॉट ब्रीदिंग द सेम एयर एज द पर्सन इन्फेक्टेड विद टीबी, देन यू वोंट बी अफेक्टेड विद टीबी. ओके, so how does it spread? TB germs spread when a person suffering from TB coughs, sneezes, speaks, and spits in open spaces or in still water. And similarly, इसके spread होने के chances overcrowded places या ill ventilated places, unhygienic environment, या जहाँ direct sunlight नहीं आती, वहाँ spread होने के chances ज़्यादा है. Okay. Apart from that, people with weakness or people who have low immunity, who do not get a nutritious diet, are more susceptible to TB. So it all depends on your immune system and your immune resistance to the organisms. Okay. So if you have a good immune system that can resist the TB bacteria, then you will not be, matlab TB आपको कुछ, you won't be affected with TB. Okay, so it is very essential that you have a nutritious diet. Patients with other chronic ailments like HIV/AIDS, diabetes, whose resistance has become low, are also more susceptible to TB. So people who have HIV/AIDS or diabetes, उनका immunity already low होता है. Okay, they are weak already. So for a bacteria of TB to infect such people becomes very easy because they are already weak. तो उसको infect करने ज़्यादा कुछ लगेगा नहीं. There is no resistance coming from that body. Next, people whose lungs have become weak due to smoking get more easily affected in TB. Okay, similar example of smokers. So when does a person become ill with TB? About 1/3 people in the world are infected with TB bacteria, but a person with TB bacteria becomes ill only if the bacteria in the person's body becomes active. Okay, so even if, say, the Mycobacterium tuberculosis bacteria enters your body, it will not affect you or you won't get any symptoms unless and until that bacteria becomes active in your body. Okay, जब तक active form में नहीं आ जाता तब तक you will not be, there will be no harm. Latent TB or inactive TB does not make a person ill with TB. TB bacteria in a person's body becomes active only when their immunity is low. So, like I said, if there is a person who already has HIV/AIDS, diabetes, or has done substance abuse, tobacco, smoking, chronic kidney diseases, cancers, जिसमें already उनका immunity बहुत ज़्यादा low है, उसमें active होने को TB bacteria को time नहीं लगेगा, and it is easier for the TB bacteria to become active. Okay, and lack of proper nutrition as well. Again, if you're not having proper nutrition, you're anyway weak. So, like I said, TB is affected in various organs. Okay, so this is a diagrammatic representation of which organs get infected. So you have the central nervous system, that is your brain, spinal cord, nerves, eyes, lymph nodes, lungs, pleura. Pleura is the space between the lung cavity and the lung. Adrenal glands, gastrointestinal tract, pericardium. Pericardium is the covering of the heart. genitourinary system, the excretory system basically, bone and joints, bone marrow, and skin. Symptoms of TB. So these are the symptoms of TB. First is consistent but not very high fever, beginning in the evening, observed over a few weeks. So हर शाम को आपको low grade fever आता है जो every day आ रहा है for a period of few weeks, but it is not very high. So people might not take it seriously. Next is a persistent cough over a long period of time, which is not cured despite treatment. So, if a person has cough for say 2 to 3 months continuously, which is not getting treated in spite of regular, जो local medications हम लेते हैं cough के लिए, those are not working to cure the cough. There may be a blood in the sputum, decrease in appetite. This is a very important symptom. Decrease in appetite, body weight, and weakness. Okay, अगर आपका appetite कम है, so obviously you're not going to eat, and that's going to cause a decrease in your body weight, and that will lead to weakness. Apart from that, pain in the chest while taking deep breaths. Since if it affects your lungs, it is going to affect the ability for you to take deep breaths, and it might give rise to pain in the chest. So this is how latent and active TB infects. Okay, so this is the organism. If it enters your lung, and if your immune system is really good, that is your if immune response is effective, then the infection will remain limited to a small area, and it will not, it will not show itself. क्योंकि बॉडी का इम्यून सिस्टम उससे फाइट करके उसको वहीं एलिमिनेट कर देगा. But if your immune response is insufficient, then the organism will become active, and then you will get symptoms which we just previously discussed. So how do you diagnose? How does TB get diagnosed? Okay, so sputum examination. जो blood in sputum है, वो sputum को collect करके they are sent to path labs, and they are examined to for the bacteria. X-rays, sonography, CT scans, biopsies. Biopsy में क्या होता है? If, for example, a person has TB in the abdomen, तो एब्डोमेन का जो पार्ट अफेक्टेड है बैक्टीरिया से, उस पार्ट का एक सैंपल लिया जाता है एंड उसको कल्चर करते हैं, एंड देन द ऑर्गेनिज्म इज डिटेक्टेड. ओके, दैट इज बायोप्सी. एंड ऑल दीज फैसिलिटीज टू डायग्नोज टीबी, like sputum examination, X-ray, sonography, CT scans, biopsies, all these are available free of cost at government hospitals. Okay, तो टीबी क्योंकि गवर्नमेंट ने इतना सीरियसली लिया है टीबी को एलिमिनेट करना, ये सारी सर्विसेज और फैसिलिटीज फ्री ऑफ कॉस्ट अवेलेबल की गई है. नेक्स्ट इज ट्रीटमेंट ऑफ टीबी. So treatment of TB is of long duration. Like I said, TB is 100% curable. लेकिन उसके कुछ conditions है. Okay, first is that you get yourself diagnosed and you get yourself treated from a proper doctor. Don't be your own doctor and self-diagnose the disease. Okay, so getting treated is a very long procedure, क्योंकि TB का treatment जो है वो कम से कम 8 से 9 महीने तक लंबा चलता है. Okay, it goes on for a very long duration, and most of the times people have this habit कि वो medication start तो कर देते हैं, और जब symptoms reduce होने लगते हैं तो they stop the treatment in between, and this is a very very major mistake that they make, especially in treatment of TB. कोर्स जो है मेडिकेशन का, जो आपके डॉक्टर आपको प्रिस्क्राइब करते हैं, उसको कंप्लीट करना इज द मोस्ट एसेंशियल थिंग. Okay, you have to be very religious in terms of completing this course, because otherwise that TB will, relapse. It will come back. So we will discuss that in detail further. Many medications are used in combination to treat TB. मतलब there are combination treatments. Okay, 4 to 6 medications are used in combination to treat, and treatments are of 2 phases. First is the intensive phase, and the second is the continuation phase. So intensive phase में क्या होता है? The target is to destroy the bacteria and get the patient healthier. Okay, so intensive phase का अगर आपने treatment course complete किया, so you will feel that you have beaten the illness and you have recovered from the illness, और कोई symptom नहीं है, तो अभी आप ठीक हो गए हो. But this is where the patient makes a mistake कि continuation phase किया ही नहीं. So जो remainder था वो बैक्टीरिया को मारने का टाइम ही नहीं मिला. So there are two phases, and it is very essential that both the phases are taken very seriously. And जो दोनों phases की medications है उनको भी पूरी course के साथ complete किया जाए. And the treatment depends on the type of TB diagnosed, drug sensitive or drug resistant. So first of all, अगर कोई इंसान को नया नया टीबी हुआ है, जैसे a healthy person got TB, that person is a drug sensitive person. Okay. अब अगर वो ड्रग सेंसिटिव पर्सन ने इंटेंसिव फेज किया लेकिन कंटिन्यूएशन फेज नहीं किया, ओके, एंड देन सम मंथ्स लेटर दैट पर्सन अगेन गेट्स टीबी. सो अभी जो इंटेंसिव फेज की मेडिकेशंस थी वो उसके ऊपर काम नहीं करेगी, बिकॉज नाउ दैट पर्सन हैज डेवलप्ड रेजिस्टेंस टू दोज मेडिसिन. सो दिस इज कॉल्ड ड्रग रेजिस्टेंस. ओके. Treatment of drug sensitive TB, which is initially when a person is detected with TB, the first line treatment is given, which is basically a combination of 4 types of medications, and it lasts for 6 to 9 months. Now, if the person does not complete the first line of treatment, it is likely that the TB will become multiple drug resistant. I hope this is very clear to you all. If not, you all can ask me later in the comments. Okay. A person can also get infected with multiple drug-resistant TB directly from another person with drug-resistant TB. जैसे if there is a person A who has MDR TB and a person B who is a completely healthy individual, लेकिन MDR TB वाले person के droplets go on to person B, तो इसको ड्रग रेजिस्टेंट टीबी हो जाएगा. ओके. इनिशियली जो फर्स्ट था ड्रग सेंसिटिव टीबी, वो स्टेज इसको that stage does not come across this person. This person directly develops the resistance. Okay. So how do you get to know if it is multiple drug resistant or drug sensitive? So there are special gene tests which come that the doctor might prescribe agar the line of treatment is not successful. Again, MDR TB का जो type है उसमें patients usually do not respond to 2 important types of first line TB medication. तो इनमें first line TB medication does not work. And since इनका रेजिस्टेंस डेवलप हो गया है, इनको ट्रीट होने और पूरी तरह क्योर होने के लिए it takes longer. It takes 2 years or more. And an MDR TB patient has to take about 14,600 pills in 2 years. And this is strong medication. Since first line का medication को avoid कर दिया उन्होंने, अभी और ज़्यादा strong medication लगेगा वो resistance को हटाने के लिए और TB को cure करने के लिए. So since the medications are strong, they have side effects like nausea, giddiness, weakness, toxicity, etc. Now, there are other types of TB, which are XDR and TDR. Okay, we'll look at this one by one. Usually, when multiple drug resistant TB, अभी पहले हमने देखा कि जो normal first line treatment drug sensitive TB था, अगर उसका हमने कोर्स कंप्लीट नहीं किया तो यू गेट मल्टीपल ड्रग रेजिस्टेंस टीबी. अब मल्टीपल ड्रग रेजिस्टेंस टीबी का भी कोर्स अगर पेशेंट ने कंप्लीट नहीं किया, छोड़ दिया बीच में से, तो जो आता है वो होता है एक्सट्रीमली ड्रग रेजिस्टेंस टीबी. Okay, so they become resistant to even the second line of treatment, and then a more stronger medication has to be used for the treatment. Okay, I hope I'm making myself clear here. कि अगर ड्रग सेंसिटिव टीबी को क्योर नहीं किया, का कोर्स कंप्लीट नहीं किया, तो यू गेट मल्टीपल ड्रग रेजिस्टेंस टीबी. एंड अगर मल्टीपल ड्रग रेजिस्टेंस टीबी का कोर्स भी कंप्लीट नहीं किया, देन यू गेट एक्सट्रीमली ड्रग रेजिस्टेंस टीबी. Now, if you don't complete this treatment also, the third line treatment also, then you get something which is called as totally drug resistant TB. मतलब अभी कोई medication patient पे काम नहीं करेगी. And then it becomes very challenging to treat such patients. Okay, अभी all of us are very literate over here and educated and come from good family backgrounds. So we know how essential it is to consult a doctor in the first place. and get ourselves treated and to complete the course of TB. But जो slums में रहते हैं या जो afford नहीं कर पाते treatment या जिन तक ऐसी information पहुंच ही नहीं पाती है, उनको नहीं होता, they don't understand all these things. So उनको ऐसे लगता है कि first line treatment से क्योंकि ठीक हो गए हैं तो continuation phase का और medicine लेने का कोई जरूरत नहीं है. So इस तरीके से वो ट्रीटमेंट को आधा आधा छोड़ देते हैं and that's how they land up in this totally drug resistant stage. Okay, so TDR cases have been reported from 3 countries in the world: India, Iran, and Italy. So these are just examples of lung TB. This is the X-ray of a person who is affected with lung TB, and this is how a person gets skin TB. So what should a TB infected patient do? Most important is take prescribed medication. I'm stressing on the word prescribed and not self-medicated. Prescribed medication regularly and complete the medication course as advised by the doctor. Take a regular, nutritious, high protein diet. TB patients का most important होता है उनके nutrition के लिए a very high protein diet. Okay, so protein के जो sources है, for vegetarians, it could be paneer, dairy products, sprouts, beans, legumes, etc. And those who are non-vegetarian, उनको veg और non-veg दोनों के options होते हैं. So non-vegetarians can also include meat, fish, eggs in their diet, which is a high protein diet, which helps to build immunity. And that help, अगर immunity होगा तो weakness नहीं होगा patient को. I'm requesting everyone to please mute their mics. Thank you. Okay. So okay, क्योंकि टीबी का मेडिकेशन कोर्स 8 से 9 महीने तक चलता है, पेशेंट को वीकनेस आना बहुत नेचुरल टेंडेंसी हो जाती है. अ पर्सन बिकम्स वेरी वीक ड्यूरिंग द कोर्स ऑफ ट्रीटमेंट एंड इवन आफ्टर द ट्रीटमेंट. So it is very essential that they maintain their diet very well in order to tolerate the medication and cover the mouth while coughing. अभी कोरोना की वजह से वैसे भी हम मास्क पहन रहे हैं, so which is a very good practice. Then in India we mostly see people spitting on the roads, which is a very very bad practice. जिसको avoid करना चाहिए. Then regularly set the diagnostic tests done as advised by the doctor. So जो diagnostic tests doctor initially करता है TB के लिए, वो in between follow-ups पे भी लेते हैं to check how much the bacteria has subsided and where the infection is. All those living in close proximity with the infected patient should also get their checkup done and follow the advice of the doctor. So if in one household there is one person affected with TB, then even if the person is undergoing treatment, जो घर वाले हैं बाकी के, they should also get their regular checkups done with the doctor in order to be safe. And the surroundings should be clean and infection free. Now, what should a patient infected with TB not do? So the first is do not stop treatment unless advised by a doctor. Leaving TB treatment midway without consulting your doctor can be very risky. Like I have been explaining since the beginning, कि resistance develop हो सकता है and it is very risky. So you should complete the treatment. Do not keep mouth and nose uncovered while coughing. This is a very basic habit that we all learn from our childhood, and we should keep practicing this. Do not spit in open spaces. After spitting, this is in case where a person is infected with TB. जैसे अगर किसी के घर में कोई पेशेंट है जिसको टीबी हुआ है, तो उसको स्पिट करने के लिए एक सेपरेट बोल या बॉटल रखनी चाहिए है. एंड आफ्टर द पर्सन, क्योंकि अगर टीबी है तो स्पूटम आने ही वाला है, तो उनका बिलोंगिंग्स थोड़ा सेपरेट रखने चाहिए है. एंड इन वॉट एवर कंटेनर्स और वॉट एवर बॉटल्स दे स्पिट, that container should be boiled in water and that it should be discarded. So that will also prevent infection. Do not take medication without proper advice from the doctor and consult the doctor in case of side effects. TB medications के side effects होते ही है, so उसके लिए भी आप खुद से दवाई ना ले, डॉक्टर से ही कंसल्ट करें. Please remember to be alert about the symptoms of TB, not only for yourself but also for those around you, and do not ignore the symptoms of TB. Uh, TB is curable if we take the correct and regular treatment and complete it properly. टीबी ट्रीटमेंट इज फ्री. जैसे कि गवर्नमेंट ने डायग्नोस्टिक टेस्ट फ्री रखे हैं, वैसे टीबी का ट्रीटमेंट जो है वो भी पूरी तरह फ्री है गवर्नमेंट हॉस्पिटल्स में अंडर द नेशनल टीबी एलिमिनेशन प्रोग्राम. एंड देयर इज ऑल्सो अनदर प्रोग्राम कॉल्ड द रिवाइज्ड RNTCP, रिवाइज्ड नेशनल टीबी एलिमिनेशन प्रोग्राम, जिसके ऐसे एक्चुअली द थिंग इज, जब नेशनल टीबी एलिमिनेशन प्रोग्राम रखा था गवर्नमेंट ने, तो it was not catering to a lot of people. Many people were not reporting the cases also. तो अंडर गवर्नमेंट स्कीम्स उन्होंने मेडिको सोशल वर्कर्स को अपॉइंट किया, जहाँ पे अगर टीबी रिपोर्ट हो रहा है एक घर पे, सो दे गो एंड दे पर्सनली कीप अ ट्रैक के पेशेंट ने रोज दवाई ली है कि नहीं, उसने कंटिन्यूएशन फेज का दवाई कंप्लीट किया है कि नहीं, एंड उसको डायरेक्टली ऑब्जर्व्ड ट्रीटमेंट थेरेपी बोलते हैं, डॉट्स रेजिमेन. So under that, the government has also, made treatment free and also kept a watch on whether treatment is being taken and completed. Contact your nearest government dispensary, health post, hospital for free treatment and free diagnostic tests. Okay, so it is nothing to be worried about or to be scared. It is completely curable, and plus it is free of cost to be treated for TB in any government center. इंडिया हैज द हाईएस्ट नंबर ऑफ टीबी पेशेंट्स इन द वर्ल्ड. सो जितना भी वर्ल्ड का टीबी है उसमें से 25% इंडिया का है. The government of India's TB report puts the number of notified TB cases in India in 2019 at more than 24 lakhs. And it is India's biggest health problem. 4.5 lakh people of 4.5 lakh people die of TB in India every year, and daily deaths due to TB are more than 1,150. And hence, it is essential to spread awareness about TB, its causes, symptoms, and treatment. So, this is a diagrammatic representation of TB in all the countries of the world. And if you can see, India has the highest, 27%. इतना कोई भी country का नहीं है. The incidence of TB is about 211. अगर this is a ratio sort of. So अगर 1 लाख लोगों का एक ग्रुप है, उसमें से 211 लोगों को टीबी होता है at present. और गवर्नमेंट ऑफ इंडिया इज वर्किंग टू ब्रिंग दिस 211 down to 43 per lakh. Okay, and इसमें से भी 32 per lakh people die of TB in India. And now the government is working to bring this 32 down to 3 per lakh of people. And like we all know, Mumbai is very crowded place nowadays. A lot of people are resided in Mumbai, and it is very populated. So because of unhygienic conditions and proximity of people and residential areas, it has a lot of TB cases. It is also known as the TB capital of India. And in Mumbai, since those people living in slums are also illiterate, they don't follow the medical prescription of medicines and regimen, and that's why there are a lot of MDR cases in the country. TB and COVID-19. So response to treatment is poor if a TB patient is also infected with COVID-19. So अगर एक patient को TB है और COVID-19 भी हो जाता है, तो obviously उसकी immunity बहुत ज़्यादा low हो जाएगी, and the prognosis or the response will be still poor. And उसमें भी अगर TB treatment को interrupt कर दिया है, तो और ज़्यादा बुरा prognosis होता है. And now if you see, TB and COVID-19 are both infections that infect the lungs, and they also have similar symptoms like cough, fever, difficulty in breathing. So how do we know which is TB, which is COVID-19? Okay, so this is the major difference, that TB has a longer incubation period with a slower onset of the disease. इसका मतलब क्या है कि अगर किसी इंसान को माइकोबैक्टीरियम ट्यूबरक्यूलोसिस ने इन्फेक्ट किया है, तो उसको वो डिजीज एक्टिव होने और सिम्टम्स दिखने में काफी टाइम जाएगा. इट विल टेक मंथ्स टू अ ईयर फॉर TB symptoms to show and for the incubation period to be complete. Whereas in COVID-19, like we all know, 14 days may we have the symptoms that show. Okay, so this is the major difference. In the COVID-19 pandemic, TB patients are advised not to interrupt treatment, regularly consult their doctors, and follow their advice on other precautions that need to be taken. And this is a global report जहाँ पे अगर आप देखो global figures को और Indian figures को, so you know most of the cases seem to be in India. जैसे अगर total incidence is 140 lakh, then 211 lakhs are only in India. And deaths भी अगर देखें तो 4,35,000 deaths out of 16 lakhs इंडिया में होती है. एंड HIV TB केसेस मतलब HIV प्लस TB जो है 87,000 होता है इंडिया में, और उनकी डेथ्स आर 12,000. एंड एस्टिमेटेड मल्टीपल ड्रग रेजिस्टेंस या टोटल ड्रग रेजिस्टेंस में 1,47,000 cases. Okay, and this is per lakh of population. So again, these are ratios. Treatment of TB. We have a vision of a TB-free India with zero deaths, disease, and poverty due to TB. This is the goal of the government of India. And as we know, it is made free under the government scheme of NTEP available, which is through government dispensaries, health posts, and hospitals. TB is a notifiable disease in India since 2012. इसका मतलब ये है कि अगर किसी डॉक्टर को, केमिस्ट को या किसी को भी पता चलता है कि किसी XYZ इंसान को TB है, तो उसको कंपलसरी हो जाता है मेडिकेशन देने से पहले कि वो नोटिफाई करे गवर्नमेंट ऑफ इंडिया को. So all the cases are, it is made sure that all the cases are reported and basically the government is keeping a very close watch on TB to make sure it is eliminated. And since the patients need a high protein rich diet, the government also gives an allowance of 500 rupees per month to each registered patient under the Nikshay Poshan Yojana. तो अगर कोई पेशेंट है जो कि नहीं अफोर्ड कर सकता हेल्दी खाना, तो अगर वो ये स्कीम के अंडर खुद को रजिस्टर करता है, तो the government gives 500 rupees allowance every month, to help the person even recover nutritionally. So this is the helpline number for any query related to TB. It is operational from 7 a.m. to 11 p.m. on all days. और इतना सब करने के बावजूद, मतलब diagnostic tests are free, treatment is free, and also 500 rupees allowance is made, still 50% of TB cases are treated in private hospitals in India. तो government schemes का basically कोई फायदा उठा नहीं रहा है यहाँ. This is the pledge to make India a TB-free country, and this is how we can, this is just a small effort by sharing this information and acting on it when and wherever required, that we can make it come true. Thank you very much for your time and patience. And if there are any questions, you can place them in the chat box. I'll be sharing the link for the feedback forms with you all shortly. So make sure you'll fill the feedback forms before leaving.